Bruno.
Thank you, Jonathan. I mean, the report is pretty extensive, so I'll just pick some of the highlights, and want to start with also again thanking all staff, but also students and volunteers and lots of other people who have been extremely busy and helpful to deal with the pandemic. Section 7 of the report highlights a few thank yous to people that are less visible, that are actually working behind the front lines. And we've been having a campaign to thank them as well. These are people, for example, that are working in the linen team, people that work in the clinical labs. So there's lots of people that are less visible, but have been playing a crucial role to provide an excellent service during the pandemic. We've also received a lot of thanks from patients for the great service that they received. And you mentioned that we'll look at one of the stories during this board meeting. But the story of Ken and Jenny are also in the report. They're also on the OUH website, and they're, I mean, pretty heartwarming to see how, thanks to excellent care, both Kenny and Jenny, after an extensive stay in intensive care. For Ken, it was 11 days. For Jenny, it was 13 days for Ken. It was 11 weeks for Jenny that they have been able to fight COVID-19 and survived the infection. So that's what we've been dealing with in the past couple of months. I also want to highlight the comprehensive staff testing that we've done. We're the first trust in the country that has tested all its staff members for both the infection, the PCR test, as well as the antibody development against a infection that they have dealt with. And the results have been pretty insightful. Meghana will take us through some of the conclusions and especially the actions that we've taken as a result of this staff testing. But certainly also again highlighted that some of our staff members are at higher risk, especially in acute medicine, because they're really at the front line. But also the BAME staff members are at high risk, and the porters and cleaners in our trust. And so we've been responding with infection prevention and control measures, but also, for example, for the BAME staff with risk assessments that are done on an individual basis to make sure that we protect them against the virus. The report also has an extensive update on some of the widely publicized clinical trials that the Trust is running with the university for a new vaccine, which has sort of potential global impact, but also the testing of existing drugs against, see if they work against the COVID-19 infection. And we've had, again, a breakthrough that a very cheap drug, dexamethasone, actually has a positive impact on the infection and reduces the complications, yeah, of that infection. I also want to highlight the extension of the emergency department. If you haven't been on site yet, John Radcliffe, it's ready. It's shiny on the outside, but it's even more exciting on the inside, with a lot more space, especially for resuscitation of adults and children, a new CT scanner, better access for the ambulance service. So it's a major improvement, both in terms of space, but also how we work within the emergency department. And it's very well received by staff and by patients. It's been a major investment that we were able to do because of our good financial performance in the previous fiscal fiscal year. You'll have again extensive reading on all of the awards and recognitions and great achievements that have occurred in the Trust or in the Oxford BRC, the Oxford Academic Health Sciences Network, and the Oxford Academic Health Partners, which was re-accredited before the pandemic, with lots of, I think, great achievements that I'm not going to go into detail, but I'm happy to take any questions on any of the detail or on the report as a whole.